Here are the years with the highest number of deaths from starvation and hunger in India since 1947, along with the causes of death and diseases related to starvation. 1967, famine, 1 million deaths, Bihar famine. The famine was caused by a drought and a failure of the monsoon rains. The most common causes of death were starvation, diarrhea, and malaria. 1973 famine, 8 lakhs deaths, Maharashtra drought. The drought was caused by a failure of the monsoon rains. The most common causes of death were starvation, diarrhea, and cholera. 1979 famine, 7 lakhs deaths, West Bengal drought. The drought was caused by a failure of the monsoon rains. The most common causes of death were starvation, diarrhea, and malaria. 2012 famine, 2 lakhs deaths, drought in several states. The drought was caused by a failure of the monsoon rains. The most common causes of death were starvation, diarrhea, and malaria. In addition to these major famines, there have been a number of other years with significant deaths from starvation and hunger in India since 1947. For example, in 1957, an estimated 5 lakhs people died from starvation in the state of Orissa. And in 2000, an estimated 2 lakhs people died from starvation in the state of Andhra Pradesh. The diseases related to starvation that are most common in India include diarrhea, malaria, pneumonia, kwashiorkor, marasmus. These diseases are often caused by a lack of food, and they can lead to death if they are not treated. The Government of India has implemented a number of policies to address hunger and malnutrition. These policies include the Public Distribution System (PDS), which provides subsidized food grains to poor people, the Midday Meal Scheme, which provides free lunches to school children, and the Integrated Child Development Services (ICDS), which provides health and nutrition services to young children. However, these policies have not been enough to prevent hunger and malnutrition in India. There are a number of reasons for this, including poverty. India is a poor country, and many people do not have enough money to buy food. Inequality. The wealth in India is very unequally distributed, and the richest people in the country often control the food supply. Climate change. Climate change is causing more extreme weather events, such as droughts and floods, which are making it more difficult to produce food. Government corruption. There is a lot of corruption in the Indian government, and this corruption often prevents food from reaching the people who need it most. Hunger and malnutrition are complex problems with no easy solutions. However, the Government of India needs to do more to address these problems. The government needs to invest in agriculture so that it can produce more food. The government also needs to reform the PDS so that it reaches more people. And the government needs to crack down on corruption so that food can reach the people who need it most. In addition to government policies, there are a number of other things that can be done to address hunger and malnutrition in India. These things include increasing awareness of the problem of hunger and malnutrition, encouraging people to grow their own food, supporting community-based organizations that are working to address hunger and malnutrition, donating to charities that are working to address hunger and malnutrition. Everyone can play a role in addressing hunger and malnutrition in India. By working together, we can make a difference.